So, what are the most sort of common neurosurgical conditions? I think the first one that we're all pretty familiar with is hydrocephalus, which is an accumulation of CSF within the ventricles, and inevitably it leads to a raised intracranial pressure. Now, I'm sure most of you or all of you are aware, that until the sutures of the skull bones fuse and the fontanelles close in a newborn and an infant, which can take up to 9 to sort of 12 months, their heads can get very, very large. And in Africa, in South Africa, in resource limited settings, I've seen images in India, some parts of China, Pakistan, it happens, sub-Saharan Africa, you get massive, massive hydrocephalus with huge, huge heads. And that's because so much fluid accumulates and it stops those sutures from closing. And so the skin just sort of accommodates this very, very large volume. So the most common causes of hydrocephalus are congenital issues with the aqueduct, so congenital aqueduct stenosis, Chiari malformations. And then the most common acquired cause, and probably the most common cause, is an interventricular hemorrhage and meningitis causing hydrocephalus and obstructive hydrocephalus. And those will be by far the sort of most common causes of hydrocephalus that we will see. Now, not all kids need immediate surgical intervention. Some present and need immediate intervention. They present with signs of raised intracranial pressure, of meningism, they may have a reduced level of consciousness, seizures, etc. So initially symptoms sort of start off as irritability, a bit of vomiting, difficulty feeding, and then it will slowly progress to persistent vomiting, to changes in a level of consciousness, to seizures, and then, very severe circumstances, we see what's called sort of sunsetting of the eyes, and nystagmus and all of those sort of things. So as the raised intracranial pressure gets worse, so the symptoms will progress.